Welcome everyone to today's webinar, Solving Staffing Challenges with Automation. I am Christelle Kazaka with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions that you have throughout the webinar by typing them into the Q&A box you see on your screen. We are looking forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link you used to log into today's webinar to access the recording. At this time, I am pleased to introduce our speaker. Tom Peterson is an investor and executive advisor for several innovative healthcare technology businesses across the payer and provider segments. Tom is a co-founder and former COO of Evolent Health, where he built, grew, and ran Evolent's value-based care and the health plan services businesses to enable it, becoming a public company with $1 billion in revenue, over 3,000 employees across 40 markets serving payers, health systems, and physician groups. Prior to this, Tom ran the technology and consulting divisions of the advisory board company and has worked in both health plans and health systems. Tom has a master's in mental health counseling from the George Washington University and a BA from Harvard University. It is now my pleasure to turn the floor over to Tom to begin today's presentation.
Hello, and welcome to the Becker's webinar entitled Solving Staffing Challenges with Automation. My name is Tom Peterson, and I'll be leading this webinar today. A little bit about me. I've spent the last 25 years in healthcare, largely working with health systems with various technology-related initiatives. 10 of those years I was overseeing the technology business for the advisory board company, and then 10 years as a co-founder and a chief operating officer of Evolent Health that worked in the population health terrain. So a little bit about our agenda today. Our plan is to talk a little bit about the backdrop in which we are seeing this healthcare staffing crisis and the environmental circumstances around that crisis. Go into the research study that Noble Health conducted and go a little bit deeper into some of the lessons and learnings from that research, talk about some recommendations on how to potentially address some of those findings, and then dive into some best practices from Noble Health, and then leave some time for a Q&A. So across my 25 years in healthcare, there's been a lot of challenges that we've seen across all that time, but I don't think there's ever been a time that's been as rife with challenges as we've seen the last couple of years, with COVID and then now the resulting impact on our healthcare workforce. And so Notable Health wanted to learn a little bit more about what was behind this healthcare crisis, and so they conducted a survey of over 1,000 healthcare professionals, just because they were looking to try to understand a little bit better how the healthcare workforce was navigating these challenges. And the short answer is, to cut to the chase, is not very well. And we'll discuss that in some detail. So not telling you anything that you don't already know, but the healthcare workforce is in crisis of proportions that we haven't seen in the history that I've been involved in healthcare. With burnout reaching pretty significant epidemic proportions, 92% of organizations saying that they have a significant issue with burnout, and the feeling that this isn't going to go away anytime soon. So we have 3.2 million workers that will be short by 2026, with both the aging workforce and individuals that are leaving the workforce, and there's just not enough supply of individuals to meet that demand, as we're seeing organizations experience significantly higher turnover than they've had in the past, and a significant growth in resignations. I think the most important thing to consider here is this in the backdrop of the healthcare, health system margin challenge. So health systems have traditionally had very narrow margins, operating between a 2 to 5% margin if they're doing well. And as a result of the increase in contract labor, the increase in supply costs, and this workforce challenge, that margin has gone negative for many organizations over the last several months and several quarters. and there are multiple factors behind this. But given the fact that this healthcare shortage challenge is not going away anytime soon, that margin pressures are difficult to overcome in terms of passing additional expenses on to payers and that sort of thing, that we really have to settle in as this being a massive, almost existential crisis for health systems with respect to this massive increase in labor costs and as a result of individuals leaving the workforce. And so we really need to pay attention and take this extremely seriously. If you see on the right here, health systems paying $24 billion more for contract labor, work for labor, but a lot of that contract labor trying to address the shortage. And when you think about the cost structure of health systems, with 50% of their costs being in labor, and if that labor cost is going up, upwards of 20%, you can think of the massive implications for health system margins. So it's not just increased labor costs. We're also seeing increased supply costs, drug costs as a result of supply chain issues, fewer outpatient visits, both as a result of having to close units for, in the past for COVID, but also for staffing shortages and having to shut down certain non-urgent procedures, and then sicker patients as a result of higher case mix coming into the health systems. So to make things worse, the technology that we have deployed up until this point has actually, where it was intended to try to make things better from a workflow perspective, has actually made things significantly worse, where clinicians, across the board are extremely dissatisfied with their electronic health records. With some surveys saying they're spending almost, those that are dissatisfied with their EHR spending three times more likely to leave the organization, and that's a significant percentage of clinicians and staff that are using those electronic health records. And then the high degree of correlation between the frustration with charting electronically and then having to work after hours to complete charting, just leading to a significant additional burden with respect to burnout. So healthcare workers are leaving in droves. They're either leaving to other industries, they're leaving the workforce in general, or they're leaving one aspect of healthcare to potentially a less intensive aspect of healthcare. And just some of the data on here, we see that 49% of workers saying that they're burned out, 50% finding a better opportunity elsewhere, looking for a different career growth, better compensation, and then some leaving just because of the challenges and concerns with respect to COVID-19. And it's across the board. So not just nurses and administrative staff, but also physicians finding that they're exiting the workforce. Also many for the same reasons with respect to too much work, little inefficiency of the work that they're doing, too much time spent on non-patient facing care, lack of autonomy and control over things that they previously may have controlled around their schedule, and need to work late hours to document after their kids go to bed, and then just a loss of meaning to the work itself, and really kind of losing the focus of why they got into healthcare in the first place. So across the board, physicians, nurses, administrative staff leaving the workforce. And when you think about it, it's obviously incredibly unsettling as healthcare operators and people that run health systems. But I think most concern is the material impact that it's having on the actual quality of care. And so what we're hearing is that the burnout and retention issues are actually, impacting quality of care, both in terms of the quality of the work that's being done. And you get some quotes here, just how the burnout really impacts people's desire to go to work and desire to sort of fight through the complexity, but also legitimate concerns about the amount of time that things are taking, and then the impact on quality with respect to follow-up and the time it takes to get an order in and delivered as a result of the complexity of that work and the documentation process, and just feeling as though the charting, takes far too long. So again, the technology that we put in place to try to address some of these concerns has actually increased the potential risk on quality and outcomes. So let's go a little bit deeper into the survey that Notable Health conducted and really understand some of the root causes of the burnout and dissatisfaction, and whether there's where there's optimism and whether there isn't actually any optimism within the workforce for things to potentially get better. So a little bit about the survey that was conducted. Notable conducted a survey of over 1,000 professionals over a couple of days, and it was across all different sizes of organizations from 50 employees on up, and it was across healthcare executives, frontline staff, physicians, ancillary staff, nurses, other clinical staff. So we got a wide cross-section of different types of workers within the healthcare workforce. So to kind of cut to the chase, what we heard from them was, both, high degree of concern about their situation today, but also, some optimism around the potential for automation to have an impact, to positively impact some of those root causes of dissatisfaction. So feeling as though the growing administrative burden was really hurting their patients and staff, really deeply concerned about this burnout, but also that they're ready for automation, and those that feel as though their organizations have made investments in automation have seen improvements and an opportunity to continue to make investments to improve there, but that time is running short, that there's just not enough time to wait for these solutions because of the massive concern with open positions, open roles, and staffing shortages. Some of the highlights of the survey, and we'll go a little bit deeper into this further in the presentation. It's just 57% are worried that they'll burn out as a result of high volume of repetitive tasks. 81% though feel that technology can actually help improve their experience, and 48% of staff just really worried about their organization's ability to stay ahead of it, to hire and retain staff, and worried that this is just going to go on perpetually. When you think about this problem, it's across the board in terms of the different ages of the workforce. So Gen X, millennials, Gen Z, all worried about burnout. And we were digging in to understand the extent to which repetitive tasks is a major contributor, and it turns out that it is. 57% of staff, stating that their organization is spending way too much time on repetitive tasks such as data entry. 32% of their time spending on tasks unrelated to patient care, so a third of their time on things that are unrelated to actually treating the patient. 57% of staff worry that they're going to burn out as a result of the repetitive tasks, and then 28% saying they've already left their job. So a significant correlation between the level of dissatisfaction, the extent to which staff are leaving their roles, and the extent of manual repetitive work that is eating into their ability to do what they were trained to do, and the reason they got in healthcare in the first place, which is to treat patients. And also a significant level of concern over complexity, and a feeling as though we've added more complexity to their work as we've tried to make it better. In fact, we made things more complex, and the impact on care, with 54% feeling as though the complexity of their work has had a negative impact on the quality of care that's being delivered, and a negative impact on the patient care experience itself, with a disconnect between those in direct patient care facing roles and those that are non-clinical, with those that are in direct patient care roles believing that the complexity has had a greater impact on patient care than those that are not. But 45% of respondents feeling as though they're frustrated by the extent of time they're able to spend on patient care. I think in terms of the good news and the potential for optimism here, there is a significant level of optimism with respect to the potential for automation and technology to improve that experience. But there's a lot of difference in terms of how staff are perceiving those differences. So 81% are hopeful that technology can have a impact on some of these challenges, but underneath the data there's some pretty significant discrepancies. As an example, there's a 44% discrepancy between executives who believe that their organization's use of technology is effective and everyone else. So executives feeling as though their investment in technology has helped in a much more significant way than the staff that are actually using some of that technology feel. With 52% of respondents reporting that a reduction in workflow due to technology, but 41% saying technology hasn't reduced their their workload at all. So you have two camps almost evenly split: those that feel like it's helped, and those that feel like it hasn't helped at all. 48% worried that these repetitive tasks are going to result in organizations being unable to keep up with the hiring needs, and that same number of people feeling as though their organizations aren't doing enough to try to address employee burnout. So let's move now to some of our recommendations. And these recommendations, are some of my own personal observations, being in the industry, and some, from Notable themselves. But I think the first thing that I want to stress is that when thinking about efficiency and automation, I've seen organizations that lose the strategic context for what they're doing and try to focus entirely on efficiency. And in my experience, it's really important to anchor any effort to drive efficiency to the broader strategic priorities of the business, whether those priorities are, growth, smart growth in areas to be able to provide more services in the communities in which they serve, or that priority is quality of care and trying to deliver high quality services, whether that priority is population health and be able to manage those populations. I think it's important to start with the strategic reason for driving efficiency, and then do that in a way that achieves efficiency of the operations, as opposed to exclusively focusing on efficiency, because it's important that everything that's done really serves the broader strategy of the business. I think secondly, I've seen time and again where an attempt to automate things for one customer or one constituent, whether that's a patient or a physician, has actually made things far worse for the downstream staff. And so we might be believing that putting a scheduling capability online for staff or for patients might make things better for those patients, but in reality, the downstream workflow implications can be a nightmare for the individual staff that then have to take that information and facilitate the actual visit. And so there's a significant risk of unintended consequences as a result of automating the process for one constituent and creating downstream challenges for another. And then lastly, there's a lot of cynicism and skepticism, understandably so, around the use of technology. There's been a lot of promises made that technology is going to make things better, when in fact it has not. In fact, has made things worse, as we've seen with the implementation of certain technologies. And so you can get a lot of eye rolling when people say, help is on the way, this technology is going to make things a lot better. And it's important to really understand this comes from a place of feeling as though it hasn't necessarily helped. And so it requires a lot of change management, really requires rebuilding trust, and really engaging staff in the work, so that you actually know how efforts to try to make things efficiency will be received at the point at which those services are being delivered. And spending time with staff, listening to them, understanding the workflow, understanding some of their hesitation and concerns anytime a new solution is put into place. So we thought it'd be helpful just to run through some best practices that we've seen leading organizations deploy that are both addressing the broader strategic priority that we discussed before, while they're making things easier and reducing the complexity for their staff. So I mentioned scheduling previously, but Notable has worked with organizations to automate the scheduling process. And a lot of the concerns about automation of scheduling is around loss of control, of the schedule. And so what Notable's found is by doing this the right way, and engaging the providers in that process of automating the scheduling process, you can actually support those providers' desire for specific preferences and patterns so that they feel as though they're not giving up that control, that they can retain the flexibility that they might feel that they need, and address the priorities for the customer, the patients, and being able to access those providers when they need to be able to access them. And then while automating that scheduling process for the provider and for the patient, actually reducing the manual processes around processing those appointments. So reducing the volume, on call centers and access points, reducing the administrative burden around those access centers by streamlining not only the scheduling process, but the administrative work around the schedule and around the visit can truly result in a better experience, not only for patients and physicians, but also for downstream for the staff, the administrative staff and nurses that are working with those patients to achieve a real positive ROI for health systems and a positive experience for those individuals working in the health system. So that's our first example. Our second example is around really delivering on consumer grade experiences. So the healthcare system knows a tremendous amount around your patients, around your customers, and yet that information is often not used to create a personalized and customized experience for patients. And if it is, it requires a lot of manual work on behalf of individuals maybe doing outreach or supporting patient engagement efforts. And it's an extremely manual process to try to customize that message to the individual patient. So we've seen one organization doing this extremely well. It's actually an organization that's works in some underserved communities and has deployed outreach technology to support engaging individuals in their community that speak multiple different languages, that might have health literacy challenges, and they've been able to actually outreach and engage those individuals through more personalized outreach to engage them, to build trust, to get them in to be seen and increase the quality of their experience by making sure that they don't have to, first that any forms they're created are in their native languages or the language that their primary language at home, and that the information that they're providing is only provided once. So if we know something about you that you've completed on a previous form, that information is served back up to you next time you're completing a form, again in your primary language, so that you don't have to repeat that. And then uncovering and anticipating their needs, so that you're providing them with opportunities to provide access to different care settings and care interactions by really anticipating that. And as a result, this organization was able to increase digital patient engagement by 30% in a population that you might typically think is not as technology literate. And so that's really the focus, is to support engaging patients that may not traditionally use apps or may not be comfortable logging into a portal, and would prefer a low, sort of from their perspective, a lower bar for access into those systems, with this phenomenal patient engagement rate of 96% across all their patients. And then the third example we have here is an organization that was really primarily focused on reducing repetitive work for their staff, because they're worried about this burnout issue, worried about being able to staff appropriately, and we're really focused on reducing the amount of time that individuals were spending looking at a screen as opposed to connecting either with other staff or with patients. And we've all, experienced that that feeling of being buried in your computer screen as opposed to actually truly connecting to the other human that you should be connecting with. And so they were able to automate a lot of those data and documentation priorities using Notable's technology to automate that workflow between the providers and staff, so that they could, instead of spending their time documenting, they're actually spending their time communicating with the patient and interacting with the patient. So, that led to significant increase in available hours for staff that can be spent on direct patient care related activities. You remember that 32% stat that caregivers feel as though they're spending 32% of the time on non-patient care related activities. Now there's more time being spent delivering those services that they went to school for or trained to be able to deliver. So there's this particular organization seeing a 50% reduction in provider time spent in the electronic health record, and that time being used instead to be able to interact with patients, and a 74 net promoter score, which is comparable to Netflix. And you just see some of the specific data points here about the number of hours saved, and this is on a per provider basis. So 416 hours a year in intake, 83 hours a year on patient registration, 41 hours a year on copay collection, and 21 hours a year on appointment reminders. So you can just multiply that by the number of providers, and you see an overwhelming impact on the overall patient base and on the provider community. So we feel like there's ample opportunity to use technology. So we're hopeful that 81% of the workforce that believes that technology can be helpful to automate those work processes that will be able to impact those numbers through automation technology, and in doing so create a better workforce and reduce some of the dissatisfaction with staff as a result of some of those repetitive tasks. So with that, I will conclude the formal part of the presentation and open it up for questions. And as we get into the questions, I'm going to invite some other individuals to join me from Notable Health, who might be able to answer some of the more detailed questions that you might have.